Food safety knowledge. Introduction to personal hygiene and health. Food safety and personal hygiene are critical components in ensuring the health and well-being of consumers. Proper personal hygiene practices, such as regular hand washing and wearing clean clothing, can significantly reduce the risk of foodborne illnesses. Food handlers play a vital role in preventing contamination and are responsible for adhering to strict food safety regulations. Training and education in food hygiene are essential for anyone involved in food processing, preparation, and manufacturing. Implementing a food safety management system is a key strategy for businesses in the food industry to maintain high standards of food hygiene and safety. The Centers for Disease Control and Prevention (CDC) highlights the importance of food hygiene in preventing illnesses caused by pathogens like Salmonella. Personal protective equipment (PPE) and proper sanitation practices are part of the food hygiene guidelines to keep food safe from contamination and spoilage. What is personal hygiene? Personal hygiene is the first line of defense against bacteria and is paramount in providing safe food. In the following presentation, we will see what is meant by good personal hygiene and how good hand wash practices help us reduce the chances of bacterial contamination in our workplace. Personal hygiene is defined as a condition promoting sanitary practices to the self. Hygiene is the science concerned with the prevention of illness and maintenance of health. It is important to know, understand, and practice good personal hygiene to prevent any illness by spreading germs. Good practice by the food handler at all times is important to protect the consumer from the risk of microbiological, physical, and chemical contamination and food poisoning. Good personal hygiene is not only essential to prevent contamination of food, but it also makes good business sense. Customers like to see food handling staff taking personal hygiene seriously and practice safe food handling. Why? I must wash my hands. To prevent cross-contamination. Hand washing helps prevent the transfer of harmful bacteria and viruses from one surface to another, which is particularly important in food preparation and healthcare settings. To prevent spread of disease. Regular hand washing can significantly reduce the spread of infectious diseases, including respiratory infections like the flu and gastrointestinal illnesses like norovirus. To protect personal health. Clean hands can stop the entry of germs into the body, which can lead to infections or exacerbate chronic health conditions. To remove dirt and chemicals. Washing hands thoroughly can remove not just dirt, but also harmful chemicals and substances that one may come into contact with during daily activities or occupations. When should I wash my hands? After visiting the toilet. After touching body parts. After blowing your nose. Coughing and sneezing. Before and after lunch and tea breaks. Before and after touching food. After handling rubbish or waste. When they are dirty. After smoking. Hand washing procedure. Number 1. Get your hands wet with warm water. Number 2. Apply enough disinfectant soap to cover your hands. Number 3. Rub hands together in a rotary method. Number 4. Scrub both sides of your hands and between your fingers. Number 5. Rinse off all the soap with warm water. Number 6. Dry your hands with the clean towel or tissue. Good hygiene practices. Shower daily. Brush teeth twice a day. Use deodorant. Put your hand in front of your mouth when you sneeze or cough. Neatness of uniform. Clean clothes. Keep your hair neat and tidy. Keep fingernails short and neat. When must I wear personal protective equipment or PPE? To use gloves. When working with harmful chemicals. When touching ready-to-eat food. When cleaning toilets. When sorting waste. When I might touch blood or body fluids. Smoking rules. Apart from the obvious risk of fire, smoking cigarettes is forbidden in food preparation and storage areas because of the likelihood of transferring Staphylococcus bacteria from lips to hands, and chewing tobacco prohibited for the same reasons, as well as the fact that it builds saliva in the chewer's mouth, resulting in the need to spit. Illness. All employees must report to the supervisor for any of the following condition or situation: fever, vomiting, diarrhea, cuts, burns, skin rashes or scratches, any communicable diseases. Supervisors must identify unsanitary and unhealthy personnel. Observations made by supervisors at the beginning of the work shift and throughout the day are the only effective means of identifying health risks. Things to look for include cuts or burns on fingers, hands, and arms, oozing sores, pimples, or boils, and significant coughing or sneezing. The company's standard operational procedures provide a list of communicable diseases that must be disclosed to the supervisor by the worker. Acute gastrointestinal illnesses, such as jaundice, diarrhea, and sore throat with fever, and other diseases transmissible through food, such as hepatitis A and Shigella species, are just a few of the reportable diseases and symptoms. Food service workers that are sick or have had diarrhea must be cleared by the company-appointed doctor before returning to work, and SOP outlining criteria for sick call, prohibiting personnel from working in food preparation or service areas, and return to food service duties must be established in the food service facility and approved by the contracting clinic. Thank you for watching and listening. Follow and likes for more videos. Food safety knowledge.